My name is Larissa, and today I'll be talking about a study that looks at the aerobic and anaerobic fitness levels and its effects on bone mass density. Firstly, bone mass density is linked to osteoporosis, which is when bones have a low bone mass density. This leads to deterioration in the tissues, which causes fractures in the bones. This chronic disease is considered silent since there are no obvious symptoms and can consequently result in the loss of mobility and independence. But 1 in 3 women and 1 in 5 men are affected by osteoporosis, where 80% occur in ages 50s and older. According to the National Institute of Health, at least 50% of women and 25% of men ages 50 and older will experience at least one fracture due to osteoporosis in their lifetime, where 28% of women and 38% of males will die within their first year of a fracture. Clearly, age is a huge factor, including sarcopenia, which is a natural loss of bone tissue due to aging. This study focuses mostly on the physical activity factor, where they're measuring muscle strength, power, cardiorespiratory fitness, and to see if it has any changes on bone mass density. It was an observational cross-sectional study done at the Research Center for Prevention and Health, where they measured VO2 max, lower limb extension power, and hand grip strength. They hypothesized that the greater the selected fitness levels were, the greater association it would have relative to bone mass density. If stress is applied on a bone through physical activity, then it should strengthen the internal structure of the bone, increasing bone mass density. This would include activities such as swimming because they're not weight-bearing exercises to the bone. Previous studies have shown that post- and premenopausal women have been able to reduce the bone mass density loss by including physical activities such as jogging and high-intensity training. But what about the men? The study focuses solely on men aged 30 to 60 with no other confounding factors such as diabetes or other functional limitations. 153 males consented to a bone mass density evaluation, where their physical activity, alcohol consumption, and smoking levels were self-reported. They started by measuring their waist circumference, height, and weight. They determined muscular fitness levels by using a JMAR dynamometer for hand grip strength and a Nottingham leg extension power rig for lower limb extension power. To determine cardiorespiratory fitness, a Wattmax test was used on an electronic Monarch ergometric machine as an indirect maximal cycle test. After, they measured bone mass density in the spine at the lumbar region L1 to L4 and at the total hip region using a Hologic Discovery DXA scanner. The results were fairly obvious. The hand grip strength had an increased bone mass density at the lumbar spine, and the lower limb extension power had an increased density at the hips. The VO2 max test had shown an increased bone mass density in both the lumbar spine and in the hip region. This matches results from a similar study where VO2 max had shown an association with bone mass density at the lumbar spine by L. Hage and others. Another cohort study done by Hertfordshire had shown an association between hand grip strength and bone mass density, and also supported the idea that a higher muscular strength had an increased bone mass density. This study did support its hypothesis, where hand grip strength and lower leg extension power were associated with a higher bone mass density at the lumbar spine and at the hips, respectively. Since this was a cross-sectional study, they would not be able to determine a causality. Further investigations for men will need to be done, focusing more on the differences between cardio and muscular strength training on bone mass density. Most importantly, physical activity is highly recommended for both females and males to help reduce the effects of osteoporosis. Thank you for watching.